So the first is an older, like 2005 case study, small, 36 women, but it was 36 women who had been diagnosed with unexplained infertility. If you've followed me for any length of time, you'll know that I have an obsession with explaining unexplained infertility. So to be able to add this to the list of things is so validating. So 36 women, unexplained infertility, meaning they did a bunch of lab work. They were told everything is normal and they're still not getting pregnant. They were more likely to have a ferritin level of less than 30 and lower hemoglobin and transferrin saturation. They were also more likely than their counterparts to have higher levels of thyroid antibodies, which is interesting. And so one of the ways in which anemia impacts fertility is actually by impacting the thyroid. A 2025 study. So to kind of sum that up, small group of women, okay, but they all had unexplained infertility and they were more likely to have lower levels of ferritin. So they're seeing women with low ferritin are more likely to experience infertility. And for these particular women, it was unexplained because they hadn't found anything in the traditional workup, which you know by now, if you listen to the podcast or if you watch my social media or you do any of our content, is that we just need to dig deeper, right? So maybe this is something we need to dig deeper into with you as well. A newer 2025 study, larger, looked at 292 women who were diagnosed with infertility. So they've been trying to conceive for more than 1 year and had not achieved pregnancy. And they also had anemia. And they gave these women IV infusions of iron. So what we're going to talk about today, what I did in December. After the infusion, there was an increase in the number of pregnancies and a decrease in the number of miscarriages by 68%. That's huge. Like when we're talking loss, that's fascinating. They also increased the number of live births by 3.2 times. So 3.2 more live births than they had before. This is like obviously a large multi-year cohort study that they looked at. So less miscarriages, more live births when the iron deficiency was corrected. So not only do we see in one study that there's a correlation between trouble conceiving and low iron, but now we're also seeing, hey, when we treat that, it gets better. So there's something here. There's more to it. Do we need more research? 1,000% yes. Okay. We do not have enough research in this area at all, period. But what we do have, we can already see like there's more to this story. Iron is needed for proper thyroid function and ovarian signaling. So right off the bat, we know that thyroid is important and we know that ovulating is crucial. If you're not ovulating, challenging, right? If you're not ovulating consistently, it makes timing challenging. If you're having thyroid dysfunction, we have other hormonal issues that can come to play. So iron plays a role in those things. So the role of iron in the bloodstream, our body creates red blood cells. There's hemoglobin in that red blood cell. That hemoglobin carries oxygen to all of our tissues, all of our organs, all of our muscles. All of those things need oxygen. That's some of the symptoms that we're going to talk about later. But also, if we bring this back to fertility, our ovaries that house our eggs, if they're not oxygenated, what do we think that tissue is going to look like, right? If you looked up a picture of well-oxygenated muscle and poor oxygenated muscle, it's gross. Like it looks gross, right? So we don't want our ovaries to look gross. We want our ovaries to be happy and healthy and creating happy, healthy, vibrant eggs. And they need oxygen to do that. Once our iron is deficient, our body automatically starts to reroute what we have to the crucial organs, your brain, your heart, your lungs. The secondary things, your digestion, your reproductive organs, those things, less crucial. That's not keeping you, your ability to get pregnant is not keeping you alive. Your ability for your heart to pump and your lungs to actually breathe and move, keeping you alive, right? So your body is always diverting resources that are deficient to the organs that are actually keeping you alive. And we'll talk about that too. Okay. So it impacts egg quality, potentially impacting implantation by that uterine lining. So if we're not oxygenating that uterine lining, it can't grow, it can't thicken. Maybe you have a thin lining. Maybe you know that about yourself. Are you anemic? Do you have iron deficiency? Are you having poor blood flow that's actually impacting your body's ability to even try to thicken your lining. Things to think about.